I will invite up Elder Darlene to do a welcome to territory.
Thank you. That was really a light clap. Let's hear a bigger clap, hey? Let's try this again. Hadi. Hadi. There you go. That's how you do it. Well, I'm so happy to be here celebrating Dr. Sanders' promotion. I have to speak up? I have to yell, she said. Anyways, look at the people who've come to support her and all the little ones. How exciting. What a beautiful place to be. So in saying that, I want you, as you sit, to take a nice deep cleansing breath throughout your whole body. Nice deep cleansing breath. So as we remember our breath, we come and acknowledge ourselves. And in this day and age, it's about self-care. A lot of you have so many responsibilities and shoulder a lot of responsibilities. And so you need to take care of yourself. And one of the ways is by your breath. And then you pull that breath all the way down into your feet and you connect with beautiful Mother Earth on this beautiful Clyde traditional territories we have here. And, just honor what Mother Earth does for us. She who sustains our life on this earth plane, giving us everything we need. And so we need to acknowledge that and remember that. So, do I have to hold this here? Over 9,000 years, as proven by lithic evidence, the Clyde people have lived with an ancient belief. We, the people of the mighty Fraser-Nechako rivers, believed it was our innate responsibilities was to protect our waters, our land, our relationships with the animal world. For the salmon who made their way up to their spawning grounds, giving up their lives for the birthing of the new. The salmon also provided food for our people, food for the wildlife, and now we know that salmon also provided food for the forest. Chunto Wadajut, the only inland rainforest in the world, which is under our protection, also provides lithic evidence of the salmon's DNA in the great cedars. The great cedars that have been around for over thousands of years. 9,000 years of the memories of the Clyde people who have lived in harmony with Mother Earth. We now invite our guests to come to our unceded ancestral territories to honor our people. A remembrance of our gift to you. Let us together live in harmony, work with respect for one another, and play as we come together on our beautiful lands. Our ancestors have always welcomed people to our territories. Today, we honor Dr. Caroline Saunders, UNBC School of Nursing, who recently was promoted to professor, and we're here to celebrate her. Caroline is a nurse who has over 40 years experience as a nurse, scholar, educator, and leader at UNBC, and that has always focused on children and pediatrics. What better place to honor her? And that is at the Exploration Place Museum. On behalf of the Clyde Tenay's elders, our youth, community members, and chief and council, it is absolutely our honor to welcome each and every one of you to our traditional territories. All my relations, let's see, thank you.
Okay, how many people here wanted to be a professor when they grew up? Any of the little ones? How many people wanted to be a dean? Nobody. Okay, well, I'm here today. My name is Nathan Lachowski. I'm the Dean in the Faculty of Human and Health Sciences, if you haven't met me. It's just another fancy academic title. We've got lots of them going around. If you want one, come talk to me later. Thank you for everyone for coming here. It's great to see this turnout. I know it means a lot. This whole idea of being here was Caroline's idea, which I think just speaks to her creativity and uniqueness. This whole area is available to us. So We're here from 4 till 6, so feel free to explore. Adult or little one, if you get bored during these conversations, these presentations, you can explore. If you don't have a little one, you can pretend you lost them and go wander. That's all good. If you find one, we're going to collectively take care of them. All that for today. So thanks for being here. I'm just going to introduce Professor Emerita, another fancy title for Dr. Martha McLeod, who I learned tonight was the 2nd and the 13th chair of our School of Nursing. So Martha, over to you.
Hi there. I am so delighted to see so many people from so many different areas of practice in the community and in the university here today. And it's quite fitting that Professor Sanders' lecture is on the first day of National Nursing Week. Carolyn's talk is really a fitting tribute to this year's theme, which you see here, the power of nurses to transform health. Now, I'll not forget the first time I met Caroline in 2015 when she came over for an interview for her position at UNBC. Now, I knew at that time she was already a renowned clinician and clinical scholar in England, where she had recently received the highest national honor of being awarded an MBE. That's a member of the most excellent order of the British Empire. For her meaningful and ongoing contribution to children's health. Importantly, she'd been nominated by the families with whom she worked and cared. Now, when we went to Terrace, we flew over to Terrace so she could see the clinical and nursing education realities of Northern BC. I was really concerned at that time about how she might make the transition from urban England and their specialized services to rural and Northern BC with its need for generalist practice. Well, you can see by the kind of event that she wishes to have here today that transition, she made that transition. I need not have worried. Although it was not always a smooth path, Carolyn made that transition work. Her adventuresome spirit, creative approach, and rock-solid commitment to the health of children and families made the transition to a university-based academic life possible. Now, that's not to mention the support she received from her loving family, who are here, and who are here today. That's right, Jonathan particularly. Now, Carolyn made the role her own. Now, Carolyn has continued to find ways to maintain a direct presence in clinical practice. She has always involved patients and families in her research before there was the patient-oriented research endeavor in Canada and in BC. Now, she's helped always involve patients and families. She's always involved students. She has helped students to learn not only about pediatrics and the nursing care of children, but also how to practice nursing, providing care that keeps children and families always and always at the heart of every endeavor. So today, during National Nursing Week, in which we acknowledge and celebrate the incredible impact that nurses have had in shaping healthcare, driving innovation, and advocating for patient-centered care, it is so fitting that we hear from a leading nurse, a clinician, an educator, and researcher on, as she's titled it, a journey from the heart, rooted in care and driven by change. Ladies and gentlemen, and the children who are here today, and we're delighted to have them, Dr. Carolyn Sanders. Oh, you got that.
Thank you. Caroline, do you want to use the mic so people in the room can hear you?
What do you want me to do with that one then? Hold it still?
Yeah,
It's still
so
on.
the people in. Do you think you can speak loud enough for everyone?
Can you hear me? I think we're all right.
I'm just going to share your presentation online.
Okay. Grandma not shouting. They don't match.
Oh, okay, for sure. I was gonna say,
So the guys online think I'm singing and dancing if we have both.
okay.
So they're waiting for karaoke.
You can advance the slides.
Not yet.
Maybe.
Awesome. That's great. Thank you. That'll do. Perfect. Thank you. Thank you so much for coming. Please do go and use the space. If you want to leave halfway through, I promise I'm going to be about 20 minutes. All right? That's about it. Heidi. Zeni Hanzu. Suzuki Caroline. Tsei Heisa. Hunzuzi. Udzao. I'm going to ask for some help here. So really what I'm trying to say as I learn is, hello, good afternoon. My name is Caroline. I come from Manchester in the UK. And I am very grateful that you have taken your time to be here today with me. I just want to acknowledge that, you know, we are on the lands today of the Lake Leighton people here. And this is my practice. Erica and I are both, she's online, so she can't shout at me, at which point she's smiling somewhere in Japan. And she'll be laughing about the fact that I'm still trying to practice saying this too. But welcome. And I think one of the things about land acknowledgements that strikes me so much is the fact that coming from the UK, it was a huge eye-opener to understand and recognize that I'm an immigrant here and an uninvited guest on these beautiful lands that I now have the pleasure to call my home. This was not something that was new. It was new for me when I came. So I pay respect to the land on which we stand and the journey that the peoples have made. And we heard from Elder McIntosh, her beautiful introduction for us today. The picture is not mine, but it is ours. I did see Heidi in the crowd. Yep, she's over there. She's laughing. I don't know for those that can see, there are 2 silver forerunners down here, right? Both with orange tents on, right? Matching, his and hers. That was Heidi, and this was ours. And we'd driven to, where have we gone? Tumbler Ridge. So on our first May long weekend, we'd gone to Tumbler Ridge. And Per and I, which is Heidi's husband, had said, oh, we never see the Northern Lights. Never. We sat up for about 3 hours watching the Northern Lights, not realizing they were really real. So this place is the most amazing place we have ever visited that I am grateful to call my home. This is just going to be a story. So for everybody that's little in the room, it's a quiet and quick story time, okay? So we're going to just do a bit of a story. Hello. Hi. You okay? Yeah. Okay. I know, it's a dinosaur. A little bit of history can help us understand where we come from. As you can tell, black and white photographs, so I'm not 21. I'm a little bit older than that. But I want us to take a moment to just reflect while childhood matters. I see Lisa and Lance here. Hi! My colleagues in the Sharing Early Childhood Experiences work. And what it matters is because I can guarantee that every one of you was like our little people here once today. Childhood matters because we've all experienced it. And without a good childhood and finding our space and our way in the world, it's much harder to be a grown-up. So I want us to remember that childhood matters. And that's been one of my most enormous privileges to be a pediatric nurse in my life. And a mum, and now a grandma. I'm going to give you the family context. So as you're going to look, the pointer doesn't work, so I'll point them out. And I'm sorry for the camera and the recording. My mum grew up in a housing estate in Clayton in Manchester. So they were all terraced houses. I'm looking at Phil just because Phil will laugh and he'll remember these as, yeah, Kirsten's nodding. Terrace houses, you know, we had a corner street shop. And this is where my mum came from. This is my gran and my granddad, yeah. And this is them much later in life when they went to my cousin's wedding. So they aged reasonably well, but both passed away in what we think is relatively young age nowadays. There's no pictures of my dad's parents because we don't have any pictures or photographs of them. I never knew my nan, but I did know my granddad for a while. And where my dad grew up was here, which looks very lush. So my dad grew up in this house down here, right? So a big house on a big industrial yard because they came from a place where they were contractors and big business builders. That's what they did. So my life was growing up as a kid racing around this space. So I was very privileged to have the outdoors as part of my home. For those of you that know me, yes, this is me. And yes, this is, you know, when you make a cheesecake, it's one of those spring-form tins, right? I did learn later on, for those that have tasted my cooking, to make it and use it better much later in life. This is my brother, okay? And this is me. When we came to Canada and we went to Toronto to visit my aunt, I was about 11, and it was my first flight, and I hated flying. So when Martha talked about flying up to Terrace, she has no idea how I was dreading those small aeroplane flights. I'd taken so many anti-sickness tablets that I thought I'll be asleep and she'll see me drooling, and that's not going to go very well. And then I have a brother, and this is his wife. And my brother, thank goodness, lives round the corner from my mum and dad, so I don't have to worry about their older adult care as they transition into that space where they can now boss him about instead of me. And then I've got two kids. One of them is now here, which is lovely. So she's come to visit and she's here today. And this other one, this little guy, James, he lives in Australia and is now, don't worry, Han, she's all right. He now lives in Australia with two kids and has traveled the world. And it's his fault we lived in BC. So when he was about 23? 21, 22, he came to BC to do snowboarding, and he was at Big White, and we came and we fell in love with the place. And so Joe and I said, maybe we could live there one day. Here we are. Growing up, I'll be completely honest, my life was this. My life growing up as a kid was heavy machinery. If I couldn't fix it, I wasn't going to be a very good daughter. I wanted to play on it. That was where my life was going. And my mum was absolutely adamant there was no way I was going to be a crane driver. Absolutely no way. So when I got to Ernston Grammar School, she was delighted. So I went to an all-girls grammar school. If anybody's ever been to an all-girls school, dreadful. Absolutely dreadful. I must have been in the principal's office every single week, probably every year. And as I was expected, I was a Queen's Guide, so I think I must have started to be a champion a very long time ago. And I found my guide uniform, not that it really does not fit anymore, but it has an armful of badges. So the guiding was a very big part of my life as a little girl growing up. But the biggest part really was a surprise for me. So for those that know me, I was pregnant at 16 and I had a baby when I was 17. My little boy came into the world when I was least expecting it in life. And he was a surprise. And I was like, oh, that's not going to work. I'm going to need to get a job. What can I do? So I didn't know what to do, but I thought I better get a job. So what I decided to do was the fact that now I'd started to care for this little person in my life, I could maybe be a nurse. My mom had always wanted to be a nurse, but actually she started out as a hairdresser. And she went back to school when I was probably about 11 or 12 to get all the qualifications to become a nurse, because she didn't get them when she was in school. So I had this amazing role model, right? And she did what in the UK was our enrolled nurse, so LPN. And then she did a conversion course to her RN, right? Then I had that little boy, and she was like, oh God, I need to be a midwife. So she went back to school to be a midwife. So yeah, so I can say that my journey had a ripple effect everywhere. But when I started, this is Pendlebury Children's Hospital. And our children's hospitals in the UK at the time are all very old Victorian brick buildings, Nightingale wards, lots of single beds. And what it doesn't show you on here is this is the main building. This is ICU up here. And we would find ourselves very regularly as student nurses all the way down here in the medical unit that nobody had thought to put in the main building. So you could imagine all those sick kids at 2 o'clock in the morning. Thank God for a sturdy Silver Cross pram that you could put the oxygen underneath, stick it on the kid, and push it up the hill to the main building when the kids were not well. That was my story of growing up with pediatrics. Yeah. And there was a set of 12 of us in our cohort, so the numbers were small. 3 of them are still my very dear best friends. One of them is called Caroline Sanders. She was Caroline Brown when we were students, and then she married Tom Sanders. So there's 2 Caroline Sanderses, one here, and the other one is a professor at the Manchester University. 4 of us went and did our PhDs. So that's not bad out of a cohort of 12. In about 1997, I went to work at Alder Hey. This one's not here anymore and looks like this. So Alder Hey is Liverpool. So you go from Manchester, because I lived here, along the M62 to Liverpool. About 40 to 60 minutes one way and about 40 to 60 minutes the other way, every day. Yeah? And I never thought I'd go to Liverpool because most people in Manchester and Liverpool don't get on. They really don't like each other, do they, Daisy? No, they don't. But anyway, I went and I stayed there for a very long time. Martha was right. I did go back to school and I stayed at Alder Hey and did my PhD. So I was always a clinical nurse first. Academia was not the path that I chose to begin my career. And this makes you laugh. Yeah, we did wear the uniform. Yes, we did have the belt buckle. We had got rid of no, we still had the hat, but we didn't have the flowery cuffs that you wore. And I didn't have a cape, but I did have a gabardine. And the one thing I'd say is invest in good shoes. You know, with hindsight, as a student nurse, I really wish I'd got good shoes. My feet have never been the same since. I found my belt buckle about 3 days ago. I tried it on. No, lots of things change in life. There's no way. It might fit around my leg now, but it's not going to fit around my waist. And these were the badges you used to get because I wasn't trained in a university. I was trained by a health authority. Salford Health Authority, I did my nursing at for 4 years. So I left my nursing with no nursing degree, no diploma, just a nice little certificate in a red binder from the English National Board going, there you go, you're a nurse, off you go, tally-ho. And I remember my first day at Pendlebury, I still had my check dress on, and the sister gave me a bunch of keys, and she was like, okay, I'm going on my lunch now, it's all yours, bye. So yeah, lots of things are still perhaps very similar for our new grads. These are 2 of my best friends from when I did my training. And this is me getting a PhD. So the kid who got pregnant at 16, had a baby at 17, has lived with raging dyslexia all of her life, can still get a PhD. So can you, if that's what you want to do. Okay? And then I wanted to think about research. So I went to have a look at who'd inspired me to be curious. I didn't show you my school report before. I didn't dare, because as I flicked through it, they were like, could try harder. Tries hard's not very good. Tries hard, ooh, this is a D. So out of a class of 25, I was probably 23 to 25 most of the time. But it didn't stop me. So here, this is a guy called Adrian Bianchi, and he was the guy who started off my curiosity at Manchester Children's Hospital. We had lots of children who were born with short gut, and we didn't know how to keep them alive. So what we did is he did lots of surgical innovation to try and keep these children alive, whilst we learned how to manage their TPN, their nutrition, through a central line at home. We had no home care community services. So as a group of nurses, what we'd do is we'd go to their house on the way to work and take them off the nutrition and go on our way home from work to help them get on their nutrition. So we found ways to make a change to get these kids to live at home, because they were age 2 and 3 by the time they were leaving us from hospital. So they needed a life away from us out of hospital. I can't imagine Daisy, our little one here, having spent all of her life so far in hospital. I'm glad we've changed. I then ended up in pediatric urology, and it was this guy, David Lloyd, who said, hey, you could write a paper and submit it to the British Pediatric Association of Urologists, because I was now a urology nurse at Alder Hey. And he said, you can write that about hyperspadias. And I was like, yeah, okay, of course I can. And I won a prize. And I had to go and to present to all these surgeons. It was really exciting. And I was kind of like, okay, what's next? So I met this guy then, and he was the urologist at Alder Hey. And I said, I want to learn how to write papers. You write them prolifically. He must have had hundreds of papers, Tony Rickwood. And I said, and he was like, yeah, well, I'll help you write because your English is not very good, is it? And I was like, no, have you seen my grammar? That's even worse. And he did. And he helped me massively. And he helped us with setting up nurse-led research clinical trials, because that was the time where we didn't have a clinical trials unit. And I said to Tony, but I want to do this so that I can get this money to invest in this service for these children. And he said, oh, all right then. So we traipsed around the hospital, getting the signature of the chief pharmacist and the CEO, just so that we could run a tolterodine trial, which is a medication trial. And then we took what was about £40,000 and were able to invest it in our pediatric urology service. It was a game changer. We went from a team of 1 to a team of 8 and led an international service because we used research ground in practice to give kids what they needed access to. And we had a lovely team who were able to help us. This guy is just on here because this is Paul Mitrofanoff. So for any of you that have ever come across anything in urology, I'm not going to tell you what a Mitrofanoff is. You don't need to know. However, it always astounded me that they called their surgery after their names. So this was Paul Mitrofanoff. And I was blown away when I met him. But he was the sweetest French guy who came up with this idea to help change children's lives. And then all of our surgeons copied it and did it every day. And we were left trying to help the families have their best lives with the surgery that we did with them. Okay, so nursing research, the kangaroo is real because I must have hopped from one thing to about 20 million others. I love the people who have a research career who start in one thing and finish in one thing. Wouldn't that be nice? I'm not sure nursing's always like that. So there are lots and lots of things that I have done and lots of methods. And I remember my supervisor, there's a picture of Bernie on here somewhere in a bit that says, you have a choice. You can either become a methods expert or you can become an expert in something that you want to research and try different methods. So I was like, squirrel, headlights, I'll try lots of things. And then I did get a little sidetracked once I got here and I was like, oh, my research career is not going to work the same way in BC as it did in the UK. So I had to diversify. And there are so many areas that I have explored since I've been here. I have to laugh. This is a few of my urology team when we were in the UK. And just before I left, they had a spate of wearing minion masks and they gave me GRU. No comment. At which point then there are pictures all over the hospital, all around where they went to go on conference because we would make enough income to be able to send them to conference and make sure everybody got access to education. So they always made me laugh. But the key part is the fact that by building our service, when Alder Hey was renovated, this is the new Alder Hey. Oh, it's beautiful. It's lovely. Not as nice as Melbourne Sick Kids, but it's nice. We have a urology nurse-led treatment centre. We grew that. We made that. We're the only nurse-led unit in the hospital, which was amazing. And that was based on the fact that we had commitment, determination, and also we used research in a way that changed evidence on the practice floor. We worked with industry. Pediatrics is low-income money. People don't want to invest in us because we're not a big healthcare user. We're a fraction of what gets used, which is why pediatrics has a hard time all the time. But with working with industry, we help them create products. This is for managing your bowels, and this is for managing your pee. We won't go into detail anymore. It's a varied audience. But what we also did was work with lots of charities. So this was about the work that I do for children with variations of intersex characteristics and women and things with congenital adrenal hyperplasia. So when we have differences in how our presentation is and our sex characteristics, this is their first introduction booklet, which we helped to create. It's now in 15 languages. and everybody uses it around the world. That's amazing that we've helped so many people's lives. This is another one that young people helped us do about, I go to clinic and nobody asks me the right questions. We sit in clinic and people don't talk to me about the things I want to talk about. So how do we help people open those difficult conversations? It did spill over here. The WHRI were amazing. Leela, Martha, thank you. You guys encouraged me to apply for that grant, and I've stayed supporting the WHRI ever since, so that we have a voice in the North, and that I then did win one of their awards whilst I was here as a nurse working in BC. What else was going to show you? This was my supervisor, Bernie, and if you ever get really bored, yes, you can find me on Children's Hospital. There is, I did, and I am on the BBC documentary. So if you ever have 10 minutes, you're bored and you know nothing else to do in life, you will find me on that television series. So we've been on the television, we've been in the research, we've done the news, we've built services. Nurses are amazing individuals. Don't ever forget that. And one of the things that really helped me, and this is the most boring slide in the presentation, but it's here for Nate, right? It's just for Nate. Because if Nate can do anything, this is a game changer. This allows nurses like me to stay in practice and have an academic space. The UK was amazing. So I didn't do these two, but I joined here as an NIHR fellow, and then I had a higher award. So I went up some of that food tree and have friends here, is to say that, you know, if we can find a way to close that gap, to keep people in practice where your heart matters, because we care about what we do, then actually the world is a good place. Nate, it's your job. Awesome. We do change things at operational levels. Martha said it before. So you're right, I did get to meet King Charles. He wasn't King Charles then. It was just Prince Charles. But it was okay. So yeah, there's me and the short black hair. Okay, that's when I first came. So yeah, I did get to meet him, and it was the children and families. And your organization has to support you, but the children and families were like, hey, this nurse has changed our lives. And there was groups and groups of them that put that application together and put it and sent it to the trust. So what a moment for me to realize the things that we did made a difference in people's lives. So much so that I still hear from so many of them today. Hello. This is Ashridge Business School. So as part of my fellowship, I got to go there. Yeah. And I got to work with lots of people from NHS England. I did. Yeah. They were great, weren't they, for Grandma? They were. What can you see? You dancing? Yeah, I would dance too. Yeah. I'll just watch that wire though. Maybe not. Daisy. Let's watch that wire. This way. Where's Mummy? There we are. But this was actually Henry VIII's, one of his stately homes. So it was a huge thing to go and live in a piece of history whilst I did that fellowship award as part of that. Although I never got to saw the ghosts. It was supposedly haunted. Prince Harry, I have to confess, I've met him a few times. He's the same age as my son. So it was like talking to my, like, whatever he was, 25-year-old boy at this point. So yes, I won Well Child Nurse of the Year award back in 2007 and got to meet Prince Harry and have dinner, and we had a big event for that. So that was very much, again, another privilege to be the paediatric nurse for the UK for that year. We have done things here though, don't forget, I know I'm in BC now, so we are trying to lead the way and change what we do for internationally educated nurses, because it's important they have a space. Being one and going through that process, I'd love to say it was an easy journey. No comment. And we also have our network with Lisa and Lance, my very dear friends who I met when they worked in the school district, that we still champion this work about an early child network across the north between health, education, non-for-profit, and school districts. And that works very well still. But if you've got any money, Nate, you know, we'd like a bit of money. We're almost there. So new country and new adventures. I sit on the board of Carney Hill Neighbourhood Society. Thanks, Lisa. and I have done for some period of time. When I got here, one of the hardest things I had was no network. Nobody prepared me for the fact that I knew nobody. Just me and Joe, Martha, and then I got to know everybody else. That was it. But what happened was the fact that before I could get going on research, I chatted to Martha about, shall I edit and do a textbook? She was like, what? So I got to know so many people across Canada. I think, Madison, are you in here? No, you're not in this one. I can't remember who. Heidi's in this one, wherever Heidi's gone. We talk about lived experience. We've done so much lived experience work. This is just an example that translates for individuals here. So we took a group of patients with lived experience over to Toronto to do some work and present about to the people with rare conditions. We also think about the fact that I did go recently, and it still is the mothership calling me home. So BC Children's is still a place that whenever I go, I do feel like I'm home. I don't think that will ever leave my blood. But I think it's been very nice to meet lots of different people there. And I'm an affiliate of the Human Early Learning Partnership now. So that works really well with population health there. More importantly, Martha told me about all the animals. And then we started seeing them, even in the garden. This is pretty cool, but not as good as Zara's garden. She's got pictures and videos of bears coming across, looking in her hot tub. And I'm like, oh, you might want to watch that. There is one of our students here today, and I don't know if Janelle is still sat here in the audience or the kids have gone to play. Hi. But it's been a real privilege to teach in the NBMP program. And I've had 3 classes, but these 2, the last 2, we really flipped some of the evidence-based work that we do on its head and made the courses experiential. And it's been lovely because this group here is our second group, and what they've done is their work has just impacted some of the surge work out of UNBC. So in 14 weeks, it shows us what our students are very capable of doing in a very good way. And for that, I am greatly privileged to have to know them as students. We're almost there. This picture, I couldn't think of anything else because this is what one of the kids did at Alder Hey. So we used to have access to so many resources. So we would do poetry, we would do play, we would do arts, we would do crafts, we would do singing, we would do dancing, you name it, we did it, all right? And the children did a whole collage of what it was like to have a urological problem and how they would come and see us. And this is one of the children's pictures that we have. So they were mounted in the old Alder Hey. The new Alder Hey, you're not allowed to stick anything on the wall, right? You're not allowed. So we kept them. And then my friend mailed this to me for this presentation to remind me. And I can remember the kids who made this together. So they must now be about 25, 26. So I think for me, one of the things is to always narrow that theory practice gap. So practice can be the place that you find your curiosity. I laugh at Esther, you know, that's where we find ourselves right now, Esther. Practice is the place that really matters. So how can we do it? And that for me is where I come from as a clinical academic. I don't think I'll ever lose that. And then my friend said to me, who happened to be Joe's supervisor when he was doing his doctorate, she says, you know what, my mantra in his life is I'm only ever as good as what I leave behind. So thank you for coming to listen to me today. I hope that, you know, you can take away that to be relational, I think is a key to what we do. Be good as what you want to leave behind is a nice way to go forward. I want to celebrate my family because without my family, this is the forgotten group that helps us get where we go. Without our family, we're less likely to get where we want to be. And my family, thank you very much. I also want to say a really good congratulations. There's a shout out, and I'm not going to say, but just wave at the back of the room. Go on, Maddie. I know I want you to. Go for it, Maddie. Yeah, you. I'm so glad that we have so many of our graduate students here who are now going on deck. Can I be allowed to say? They're going to go to the med program this year. Yay! So we have grown nurses, seen nurses come through graduate school who are now going back to give medicine a chance to be able to shape and change that future. We're almost done. You can go and get tea very shortly. I didn't know how to close, so I've asked my daughter to close for us. so that she can say a few pieces to see what it was like from her perspective as the daughter growing up with a mum who would dance around the continent and go and do different things to try and change the world one day at a time. If you're laughing at me. No, I didn't trust you to do it. I love you, but I didn't trust you to do it. So I'm going to hand you over to Hannah, and I will do grandma duty.
You just hold it.
Okay.
Okay. If anyone can not hear me, I'll speak louder. Yeah. So obviously, when I took time to reflect on growing up with Mum, who was and is very passionate about her work, my first thought was that I'm just so proud to have her as my role model. She's definitely been my person who has inspired everything I have done in my life. So for my brother and I, and I'm sure James will agree, growing up, it was just normal that Mum, who she is and did what she did. She obviously was a single mum before she met Dad, and worked incredibly hard to make sure that we didn't go without anything. She always made time for us as kids and made sure that we had like lots of lovely memories together. Obviously later on, as my brother and I got older, she was able to take time to focus on developing her career. There obviously were difficult moments in that, especially when I was a teenager, and I'm sure Mum will agree with that, and Dad too. I was a nightmare. And I'm sure I have that coming. So I'm sure payback is, yeah. But as I look back on it now as an adult, she needed, and more importantly, she deserved that time to focus on herself. She hadn't had that before. She'd given so much of herself to us as children that when we were older, it really was just, it was Mum's time. And it showed me that it's also important to bet on yourself. Mum's drive taught me so much about the importance of hard work. And I think having that example and encouragement has led me to do something that I'm passionate about. It's why I studied journalism, which is a hard career to get into, chased my love of writing, and made sure to do a job that actually excites me and brings me joy. So I want to finish this by just saying a few things about Mum, and I'm sure lots of you will agree with what I'm going to say next. But firstly, I'm proud to not only be her daughter, but also to have the opportunity to be here today, listening to her and being able to support her in person. That's rare. Usually it's virtual. So my mum is one of the most wonderful women that I've ever known. She's taught me how to be resilient, brave, to not let your past define you, have strength, nurture your passion, share your voice, and not be afraid to do so. And that kindness and thoughtfulness go an incredibly long way. And most importantly, she's shown me how to be the best mum to my little girl, who is hands down the best thing I've ever done in my life. And I'm sure everyone who is a mum will agree. I'll round up by saying that I, along with lots of others and everyone who is here today, I'm just so proud of everything that you've achieved and will continue to, for the difference that you make in the communities that you're a part of, along with the positive impact you have in the lives of families, students, and your own friends and family too. You make the world and people's lives better, and it really has been a joy to be here today. Wow. There you go. Do you want this back?
Time to play. I think that's it. Thank you so much for coming, everybody. Time for food and play.